Welcome to CQC Connect, a podcast from the Care Quality Commission. We've been away for a little bit, but now we're back. In this episode, we're going to be talking about our approach to regulation during the COVID-19 pandemic, with a focus on our new monitoring tool, the Emergency Support Framework. COVID-19 has presented a major health crisis that has required all health and social care bodies, including the CQC, to work in very different ways. During the early stages of the pandemic, we moved quickly to adapt how we regulate and work within the health and social care system. This included pausing our programme of routine inspections, redeploying our staff to the front line of care services, supporting the national testing effort, and expanding our role in adult social care data collection. We developed a regulatory approach to enable us to deliver our purpose and be flexible enough to adapt to the changing needs of the health and social care landscape during the pandemic. This includes monitoring data to help us understand where there may be changes in quality in providers and/or emerging risks to people using services. In this episode today, we'll explore our new monitoring tool, the Emergency Support Framework, or ESF, which supports inspectors to consistently understand where people may be at the greatest risk of unsafe care. We'll be using this tool across all sectors over the coming weeks, but have been using it in adult social care since early May. We're going to hear all about it now from an adult social care perspective, through the experience of an inspector and also a provider. So right now, I'm joined by Lucy Hubble, who's an adult social care inspector here at the CQC, and Sharon Crystal, who's Operations Director with Active Care Group. So thank you both for joining us today. Sharon, if you could introduce yourself and just tell us a bit about the service that we're going to be talking about today, that'd be fab.
Yes, I'm Sharon Crystal, Operations Director for the Residential Division of Active Care Group. We're a national business and we have services all the way up in Gateshead in the northeast, right down to the southwest and the south coast. And we support people with both learning and physical disabilities. The service that I'm going to talk about today with yourself and Lucy is our Surrey DCA service, which comprises of 9 supported living sites across Surrey, supporting 138 people. Okay, so Active Care Group acquired the DCA in January 2019 and it was rated requires improvement. We've worked with both the local authority and with Lucy over the past year to remove ineffective and outdated systems, and despite the current lockdown climate, we've successfully managed to meet the deadlines of our action plan and implement all of the improvements to the service.
That's great. Thanks, Sharon. So Lucy, you're of course an inspector here at the CQC and a local inspector for Sharon's service. How long have you known Sharon and that particular service?
Hi there. Yeah, I've had the supported living on my portfolio since 2017, but I've been working particularly closely with Sharon over the last year when Active acquired the business.
That's great. Thanks both. So Sharon, it's been an incredibly difficult time across health and social care. Can you take us back to the start of this crisis and how it's been for you in Surrey?
Yeah, I think we were a bit in shock like everybody else, to be honest, and particularly worrying as we've got 320 people in our division and nobody really knew 12 weeks ago what was coming and how it was going to work out. But prior to the official lockdown, we put some restrictions in place 2 weeks before that. So we were taking temperatures of visitors, asking if they'd recently travelled abroad, asking them to wear full PPE when in the service. Because we already anticipated that, we're supporting vulnerable people and we didn't want the virus coming into the services. Then the government imposed the official lockdown and we faced a plethora of new problems, such as supporting people with autism to change their well-established routines that we've been working on for the past couple of years, and then expect people to just be able to change and do something different. I remember when we put our services into lockdown and there was talk of an official lockdown coming. And the week before the official lockdown, I sat in my boardroom with my ops team and said, right, well, we're going to need a plan. We're going to have to plan this, how we're going to manage it. So we decided to write a risk management plan. So we just basically thought of everything that could go wrong and how we would navigate around that. And we changed it every week with the ever-changing guidance that came out from PHA and the government. And we're now in version 7. We shared it with Lucy and other CQC inspectors and commissioners who wanted to see how we were managing operations during the crisis. It also included sections on the training. We were able to continue with our face-to-face training utilising Zoom. So that's been really good for us because we've had new staff start during the crisis. We've been very lucky in that we're a robust business and we haven't had any issues, touch wood, so far acquiring PPE. We've maintained our stocks daily across the business, and it was really well managed centrally so that any area of the business which did encounter an issue in getting PPE, it was sent directly to them. That actually happened in one of our services in Hartlepool. We had a staff member test positive for COVID-19 a couple of weeks ago, and we were able to send 70 visors straight up to the service in 24 hours to be used by all the staff there. So we've just kept going through our risk management plan, updating everybody that needs to see that, and we've managed to maintain the operations of the service for most of us working at home, and having the contact with the service managers and the people we support through Zoom meetings.
That's great. Thanks, Sharon, for sharing that with us and all about your risk management plan. It sounds really interesting, and I'm sure we'll discuss that more as we continue the podcast. So if we move on to a bit around the emergency support framework now, I think it'd be really interesting to hear both your experiences of how that went, and we can talk a bit more about that risk management plan. So Lucy, when it came to organising Sharon's ESF call, how did you plan it? Did it involve working with other partner agencies at all?
Yeah, absolutely, Jen. I think the first thing to say is that since the beginning of the pandemic, I've had regular contact with all of my providers to offer support and talk through the impact of the COVID-19 situation and how that's affected them. The emergency support framework really has just been an extension of those calls and has provided a framework for recording the discussions that we were already having. Sharon's service had an improvement plan in place, and so in the middle of March we had a call to discuss how we could find new ways of working together at this time. One of these ways included me attending some of their management meetings by Zoom, and this enabled me to have an understanding of what was going on for them as a service and also adopt a shared view of the risks. In terms of planning, obviously I had lots of information already available from these other discussions, and so I used this and then spoke with partner agencies such as the local authority, relatives, and had some phone calls with people using the service. And I used this information to identify some key themes that I wanted to explore during the ESF call. I also spent some time talking with Sharon and her managers about when she wanted the call and how she wanted it to take place, because I think it's really important that we have, make it as beneficial for them in terms of both time and format.
Thanks, Lucy. That's really great. This one is for both of you, but maybe you can start, Sharon. What did your ESF conversation cover?
Basically, it covered all of the tools and support that we would need to navigate the crisis. Lucy asked us about PPE, staffing levels, training, medication, and capturing the views of the people living in our services and how we were supporting them at that time. It was made very clear to us, as Lucy's just said, we'd had lots of conversations leading up to the ESF. Lucy told us when she was going on her training within CQC and she was going to feed back to us in one of our ops Zoom meetings, and she did, of how that was going to go going forward. So we didn't really, there wasn't any surprises within the questioning. It was very clear to us that it was there to support us if and when we needed it. And it covered all aspects of running a service and gave us the opportunity to provide assurance and evidence that we were still able to provide a good service to people during the lockdown period.
Yeah, so we, as I say, Sharon said, we started off by talking about PPE and any impact that was having. I was aware from some of my other learning disability services that the use of face masks particularly was having an impact for some of the people with learning disability and autism. And so we had a chat around how things could be safely managed. It was a great opportunity to talk through some of the latest guidance and how that was impacting on Sharon's service. And then we looked at other areas of management and about whether there was any other signposting that we needed to do for other organisations.
That's great. And Sharon, do you think so the emergency support framework, the ESF, it's not an inspection? Do you think that made you feel more relaxed on the phone call? Were you able to open up a bit more about what you were experiencing and the challenges?
Oh yeah, absolutely. I mean, I have to be honest and say that our last inspection was very relaxed. Lucy and my team have a really open and honest relationship, so the ESF call didn't cause us any stress at all. We saw it as a supportive mechanism from the start. Like we said before, Lucy's been dialing into some of our ops team video meetings, so we knew all about the ESF and we understood that there's some providers out there who were really struggling and needed the additional support from CQC when it came to accessing services and equipment. Our risk management plan had already been shared with Lucy, so she had a broad view of how we were managing the challenges and how we were solving those and working around them. Our whole division has been really fortunate with the support that we've had, not just from Lucy, but other CQC inspectors across the country. And I think that, I don't know how the training went within the Care Quality Commission, but the delivery of the calls, both that we've had with Lucy and other CQC inspectors, the feedback from my team is that they've been very supportive and nobody felt that they were under scrutiny. If there had been anything that hadn't been done right, then we would make that change. And like Lucy said, we had quite an in-depth conversation about some of our people in the services struggling with staff wearing face masks, and we were able to, if we needed to, we'd be able to adapt those so that people we support could see mouths and faces whilst communicating with the staff. So it didn't feel like an inspection, but as I said at the start, the last inspection was really relaxed and easy anyway, so it wasn't something that we were particularly worried about.
That's really great, and it's really great to hear that you found the experience so supportive. Was there anything in particular that from your ESF call in Surrey that helped the most?
I think we did find it very supportive. We didn't feel that we'd been abandoned. We were still having that regular communication, and I don't think it wasn't so much a feeling abandoned and us needing help, but we wanted to make sure that our quality assurance process didn't stop during the crisis, and that we were still able to evidence that to the regulator. And if we had any problem, we knew that the regulator would have been able to help us. And I think, once this is over, I'm sure there's going to be a lot of evaluating. So my view is that the ESF enabled both myself as a provider and the CQC to evidence how we navigated our way through it. And it puts us in a really good stead for lessons learned, because there's going to be a lot of those conversations at the end of this crisis. And, we've had our risk management in place since the start, and it is a really robust document. It's a bit like War and Peace now, if I'm honest, with all the changes in the guidance. But when this is over, we'll be able to go through it, look at what worked, what didn't work, have those discussions with Lucy and other CQC inspectors. And should this ever happen in the future, the future may well have a really good set of guidelines on how to get themselves through it.
That's great. And I know from talking to both of you that one area in particular was capturing user voice in the ESF call. Lucy, do you want to start a bit around that and how you've tried to capture user voice?
Yeah, absolutely. For me, one of the biggest things in the lockdown was listening to what people's views of using service were. And having had lots of engagement with the people using the supported living service over the last 3 years that it's been on my portfolio, felt it was really important to continue hearing those voices and for people not to feel that they'd been left abandoned. With the Zoom managers meetings having worked so well, I asked Sharon during our ESF call if she could help me set up something similar for people both living and working in the services. And we did this through a series of Zoom listening events last week. From my perspective, it was really good to see people and to hear firsthand what the issues were that were really important to them and how the experience of lockdown had affected the service that they received. I've got some really great feedback, both for us and for the service. And I'll let Sharon feedback about how things went from her perspective.
Yeah, for me, it was really good because we've still been having our tenant meetings. It's been a bit more difficult because, our communal areas in the supported living services aren't big enough for 30 people to sit 2 metres apart. So we've been very fortunate that the weather allowed for us to be able to utilise the big gardens that we have, and we were able to do social distancing tenant meetings that we would normally do. So people were still able to be heard, and their feedback of the service was still captured by us. So when Lucy got in touch to say that she would like to host some Zoom meetings with the people we support, we thought it was a great idea, because Lucy's had lots of dialogue and conversations and communication with a lot of the people in our services over the past few years. So, in a time of crisis, I think that, Lucy she's a part of our team, an extension of our team. So they would expect to have some conversations with her. And I don't think there was nothing that came out of those meetings that we weren't already aware of in terms of some people's anxieties. But the people really enjoyed having that forum to be able to speak and know that Lucy still cared, quite frankly, during this crisis. So yeah, it went down really well, and we would be happy to do that again, because it's also part of our own continual improvement leading up to our next inspection, that Lucy's able to to capture the day-to-day issues as well as the pandemic crisis issues and how we're dealing with those.
Lucy, it'd be really great to end this podcast today by reflecting on how you're sharing learning across the services in your portfolio.
Yeah, absolutely. One thing that's really struck me through my engagement with different services is that how the impact of the pandemic has been so different across the different settings. I found it's been so important to tailor support to providers and the way that people in those services need it. And the emergency support framework has really given me that flexibility. The calls are a great opportunity to share what's working well as the difficulties and challenges that different people have had across the sector. For example, at the beginning, I was sharing local contacts and tips for using PPE. And now latterly, we've been looking at the creative use of technology and how services are safely managing with the easing some of the restrictions. Different providers have told me that it's been reassuring to hear how things that they're looking to try out have been tested in other settings. So it's been really good from that point of view.
Really great. And thank you both for joining us, especially Sharon. Thank you so much for taking time out today to record this podcast with us. If you'd like to learn more about CQC's approach to regulation during COVID-19 and keep up to date as we transition into recovery, please visit our website www.cqc.org.uk, where you'll be able to find a range of resources, including guidance on the ESF and also a helpful webinar which talks you through what to expect in your conversation. You can also join our online engagement platform and feedback your ESF experiences and the issues affecting you right now. There's a link to this in the episode description. We've lots of CQC podcasts coming up, so join us next time.